Best double eyelid procedure? I'm 15 and I'm flying out to Korea this summer break for about a month to get my double eyelid surgery. I've read online about different procedures such as full incision and partial incision. After using double eyelid glue and tape, my eyelid skin started sagging a little. And now, on one eye, there's a crease forming, but that's not the line I want my double eyelid. So as for me, what procedure is recommended? I want a permanent result. And is it okay that I'm doing it in summer?
Thank you for your question. You're 15 years old and you've been doing a lot of research about how to get an eyelid crease, and you're asking very good questions about the different types of procedures, and you've also described how you've been using eyelid tape to try to create a crease, but you described some issues with sagging and the eyelid skin not responding the way you'd like. So to help you understand what's the best procedure as you've asked, I'll explain to you how I do my consultations in my practice. I'm a cosmetic oculofacial plastic surgeon working in Manhattan and Long Island for over 20 years in practice, and I have a particular area of specialty in Asian eyelid surgery. And I do all the different methods and techniques, and I customize these to the individual. So what's important to understand is there is no one best method, but there is usually a better method that's right for your individual situation. So I'll share with you the approach that I have when I meet a patient in consultation who expresses an interest in having an eyelid crease. To understand the anatomy as well as some of the genetics, we have to look at some of the details of eyelid structure. It's well understood that approximately 50% of people of Asian origin have an eyelid crease, while 50% do not. And there are people who have a partial crease and maybe multiple creases, and they want to have one defined crease. So there is a wide variety within the 50% who haves and the 50% who don't have the crease. But when we look at the anatomy of Asian eyelids, it has to do with the muscle called the levator muscle. The levator muscle is like the word elevator. It's a muscle that lifts the eyelid. And what comes off of the levator muscle are these fibers that go into the skin. And when they go into the skin, they pull the skin in and they create a crease. So every Asian eyelid surgical procedure, whether it's an incisional, non-incisional, partial incisional, has something to do with creating that connection. So how do I make a decision on whether or not to do an incisional technique versus a non-incisional? Well, the first question I ask to myself when I'm doing my physical exam is there fat that's getting in the way of the eyelid crease? Is there extra skin that is obstructing or overlapping and preventing a crease from forming? Those are two very important questions. And then a less frequently present but still an important question is there ptosis? Is there a drooping of the eyelid? And that drooping of the eyelid is also often related to the muscle, the levator muscle, and we need to recognize that before doing the eyelid surgery. Now, with those variables understood, for someone who is young, who doesn't have fat, who does not have extra skin, my preferred technique is a non-incisional procedure. Now, the term non-incisional procedure isn't quite accurate because by design we are making little openings into the eyelid skin, and what we're doing is along the natural crease, the crease that we want to create, there we make strategically placed openings, and through those openings we pass a suture, and those sutures are essentially creating that connection between the eyelid skin and the underlying levator muscle. Once those creases are formed, using these sutures, and it can vary. There are techniques where you do a single suture. There are techniques where you do several sutures. Again, it is about customization and looking at the behavior of the eyelid even as you're doing the procedure. A lot of times I'll actually ask my patients to open their eyes during the procedure. They're never in pain, they don't feel anything, but it sometimes helps to see the position and the movement of the eyelid as I'm doing this. So for a younger person, again, with no extra fat, no extra skin, then a non-incisional approach is preferred. Now you asked about longevity, and when you're starting at the age of 15, your longevity you have many decades ahead of you. You have to understand that as you get older, things do change. Now, it's not going to change well into your 30s, 40s, and beyond, but it is one of the concerns about the non-incisional approach is how well those adhesions form and those connections form, and will they last a long time. And there is some variability. In my experience, our patients look good and hold up for many years, and that connection does seem to work very well. But again, you have to think about different skin types in terms of thickness, as well as the lifestyle and eye rubbing and allergies and other factors that contribute to whether or not the crease holds. But I think there isn't any clear indication to make an incision if we can avoid it. And most likely in your situation, I would probably go with the non-incisional approach. So now it's your option. Of course, you're young, and so you're going to have to go with your parents or your mother or whoever your guardian is to meet with doctors to get an understanding of what's involved and what the procedure is like, and whether they're comfortable doing this at a relatively young age. There have been many patients who have come to me with their parents who wanted to have this done at a relatively young age, like yourself, so that as they got a little bit older, it was as if they always had the crease. It just seems to be a particular value that is important to some people who have come with their families in this for this procedure. So once again, to summarize, in your situation with no extra skin, which has to be determined in physical exam, in the absence of fat, which appears to be the case from just the photos you submitted, a non-incisional approach would be most likely what I would do in my practice. So I hope that was helpful. I wish you the best of luck, and thank you for your question.